As a general dentist, is buying a dental microscope a good investment? It's a bit of a tricky question to answer because there's a lot of variables that go into it. So I figured we'd start with who shouldn't buy a dental microscope and go from there. If you are a super busy dentist with an established practice and everything's going really well, you've got a system in place to fit like a ton of patients in a day, then it may not be the best for you to implement a dental microscope. And the reason being is that it takes a long time to actually master it. There's a much longer learning curve with a dental microscope than there would be with something like loupes, for example. It's pretty easy to go from no loupes to 2.5. It just takes a couple days, but with a microscope, there's so many different things that come into play. Dentists who run a practice that emphasizes oral surgery and immediate dentures, for example, also wouldn't benefit a lot from the dental microscope. I am an avid dental microscope user, and even I don't use it for surgery, so I find myself using loupes and a headlight when it comes to taking out teeth. So again, take that with a grain of salt because there are general dentists who use microscopes who love it for oral surgery, but I have found it not to be very useful. And finally, associates working in clinics with very small operatories may want to think twice about buying a microscope. They are pretty big, and even in my clinic where the operatories are somewhat bigger, it's still a tight fit. With that out of the way, let's talk about the reasons why you may want to consider a microscope in your practice, and then finally we'll cover the ROI and how to maximize it when purchasing something that is this expensive. The first reason is that you need or want to work more comfortably. I say need because there are clinicians out there who have literally stopped practicing dentistry, and the only way they were able to get back into it was through use of the microscope and the ergonomic benefits that it's provided. Once you do master the scope, the ergonomic benefits are unparalleled, and it's amazing how comfortable you can be while at work. Reason number two is that you want to see better. Whether for endo or restorative, there's no doubt that a microscope will help you see better. The question is, does this improved visualization actually translate to better clinical outcomes? I don't have a study that is going to confirm or deny this for you. I don't even know if there are those type of studies out there on the dental microscope. But after having used the scope for about 5 years, I can just think of so many examples of little subtle mistakes that I wouldn't have caught if it wasn't for the enhanced visualization and magnification of the microscope. So little things, just like matrix bands not being properly sealed to the gingival floor of a proximal box, especially in those deeper proximal boxes. It's amazing how it looks sealed at 2.5 times magnification, but as soon as you turn it up to a little bit higher, you can really see that there's a gap there and that fluid is creeping in while you're trying to fill that tooth. Other aspects of practice just become so much easier. For example, caries removal becomes even more straightforward as you start to associate the high magnification appearance of caries relative to that of affected dentin and healthy dentin. And to be honest, getting a clean margin when doing a crown prep, even when prepping subgingivally, is just so much less of a hassle because there are effectively zero shadows in the visual field while prepping under the scope. The ability to take video and photo on the fly also makes it so easy to explain to patients when they have a dental problem. It's one thing to tell a patient their tooth is weak and that they need a crown. It's entirely another to let them see the crack at 16 times magnification, which is threatening to split their tooth. I do about 99% of my checkups through the scope. We've installed a monitor on the ceiling with a live feed from the microscope, so patients can actually see exactly what I'm looking at. It's rare to have a patient not book for treatment once they've felt and simultaneously seen an explorer get stuck inside one of their cavities at high magnification. On top of that, insurance approvals are just so much easier. So for example, when you're prepping a tooth and you take an old amalgam out and you see a giant crack running across the tooth, it's so much easier to communicate that to the insurance company with a great high magnification picture. So this is really where the ROI comes in. You can really convince people that the treatment that you're recommending to them is actually worthwhile, because not only are you telling them they need a crown, but you're actually showing them the problem and helping them understand on a very kind of visceral level what is going on with their tooth and why something needs to be done. Even if I couldn't document cases or take photos, I still wouldn't want to practice without my scopes. The ergonomics and enhanced visualization alone make the scopes worth their weight in gold. Well, thank you so much for watching, everyone. If you would like to see an online microscope course in the future, please drop me a comment in the comment section below. That'll just give you an idea if there's any interest in that. And also make sure to subscribe if you haven't already so that you can stay updated about said microscope course. Exciting things ahead, people. We'll see you in the next video.